The Mammography Quality Standards Act updates remind us that every mammogram report must contain one overall final assessment of findings. Hello, it's Rick, and I'd like to invite you to join me in this mini moment about the final assessment of the findings category identified in Section 900.12, Paragraph C, Subparagraph 1, Subparagraph 4, Item B, benign. According to MQSA regulation, when selected, this assessment must appear in the test results report as benign. It is defined as a normal result with benign findings present but no evidence of malignancy if the interpreting physician is aware of clinical findings or symptoms despite the benign assessment. These shall be documented and addressed. It should not be lost in all of this conversation that the American College of Radiology also has a report organization called the Breast Imaging Reporting and Data System. This system includes a BI-RADS Category 2, benign, which is defined as a normal assessment with no mammographic evidence of malignancy. However, when using this BI-RADS category, the interpreter describes one or more specific benign findings in the mammography report. In the real world, where your breast imaging practice operates, it is not unusual for interpreting physicians using the ACR assessment category system to include multiple BI-RADS category assessments into a single report of test results when a bilateral study is performed based on the breast imaging findings of each individual breast. However, please note, the FDA's Mammography Quality Standards Act states that all breast imaging practices are required to comply with this guidance when reporting mammogram results. Overall final assessment of findings classified in one of the following categories. The assessment statement is only the word or phrase within the quotation marks. This refers to incorporating a single overall final imaging assessment for the mammogram using one of the categories provided in MQSA's lexicon and the specific wording provided in the regulations when reporting the assessment selected. This overall final assessment of benign is vital for all breast imaging practices. First, a benign assessment reassures patients that the mammogram being reported on shows no radiographic evidence of malignancy. It also ensures they can appropriately address any follow-up and management of clinical findings or symptoms that have been documented without the need for invasive procedures, significantly reducing anxiety and promoting a sense of well-being. Next, an overall final assessment of benign provides transparent and standardized terminology for referring clinicians and other healthcare providers to understand the results, reducing the risk of misinterpretation. A third outcome is that patients with this overall final assessment do not require further imaging or biopsies, conserving resources for those who need more intensive diagnostic procedures. As with other final assessments, the benign assessment was the subject of several regulatory comments and responses during the review process. A point raised in the final updated regulations is the distinction between the required assessment statement and the explanatory language. The FDA noted that the explanatory language is meant for internal use by interpreting physicians and facility personnel, rather than for inclusion in patient reports or lay summary letters to the patient. There was a suggestion that the FDA modify the original preliminary regulations wording in the definition of benign to modify the explanatory language in the context of clinical findings or symptoms that are known despite a benign assessment. The FDA agreed in part and responded by revising the final updated version of the regulations to align with existing regulations for negative assessments by adopting the language to documented and addressed. Another observation was the distinction between negative and benign assessments. The FDA maintains the negative and benign assessments should remain separate, despite suggestions that they be combined due to their similar clinical management. Separation helps identify benign findings explicitly when they are present. By understanding this assessment category's role in the MQSA lexicon of overall final assessments available to select from and its implications, healthcare providers can make informed decisions and effectively communicate with patients, ultimately improving the quality of care in breast imaging. If you like this, please give it a like. Also, make sure to subscribe for more bite-sized information about other mini moments. Do you have an opinion or idea about something you want to hear about? Be sure to leave us a comment. To get references to the information used here, check out the link to our Knowledge Hub below. Until next time, continue striving to enhance patient outcomes by delivering compassionate and precise breast imaging care.